relation to the impact that COVID-19 might have had on women moving into those leadership roles, potentially, I guess it may be, a little bit early to be able to sort of name that. I mean, we certainly see the impact that COVID has had on women generally in the workforce, particularly in those direct service provision roles, and the influence that tenuousness of employment has had through the impact of COVID. I think potentially one of the impacts that has had an influence is that lack of direct contact that people have been able to have. So, there are a lot of relationships that are built. There are a lot of relationships that are built and strengthened through that direct face-to-face contact, those kind of incidental side conversations that happen outside of meetings or board meetings or whatever's. Those are not occurring, but, and I guess you could argue that the same is true for men in those roles. It doesn't seem to influence them as much, I would suggest, because they are potentially more likely to pick up the phone outside of a meeting. They've got those established connections, through alumni or those relationships that they've built, which is not necessarily the same for women. And they're also they also have a different way of being heard around those board tables, which that hasn't changed for COVID. So, those little side conversations that women might have been able to have, which would be about generating some support for an idea or making sure that they're listened to, those are not happening, whereas men are still able to operate in the same way that they would have sitting around the table.